Yeah. Have you ever dealt with any type of like actual psychologist or psychiatrist? Like, cause like I don't know. Do you work at a hospital where you
I,
have
I
like a
work
team?
I work at an outpatient like rehab clinic.
Okay.
So it's linked to like a bigger inpatient hospital and the med
Right.
center and stuff.
Mm-hmm.
So we're like one of the out of five outpatient clinics.
Mm-hmm.
So we get a lot of patients from the inpatient side. Once they're
Mm-hmm.
done with that, they come to us.
Hmm.
I
So
see.
we
I
don't
see.
have psychologists on site. We have a social
Mm-hmm.
worker on site.
Hmm.
Mm. How is
I have
working with them, or like
very
what's
helpful
that
because
like?
yeah,
Hmm.
yeah, very helpful because we have I have dealt with some patients that they say they don't want to live anymore.
Hmm.
So suicidal thoughts. I think it was twice. It doesn't happen very common, but it has happened. So,
All right,
and then the
straight to
process that we go
psychiatry.
through.
Straight to
Yeah,
psychiatry for you.
I definitely called the social worker.
Yeah.
But it's like, yeah, there's like a process we go through, and sometimes like I don't. It sometimes doesn't make sense to me because it's like you have to call this number. I don't know what's the best way to help them in that situation too.
Right,
Mm.
because you know it
But
maybe not isn't necessarily your field of expertise, right? And that's why we
right,
need people in that field of expertise because then it's like, oh my god, like what do I do about this, right? Like, I mean, if you have like a crime, call the cops. You have a fire, call the firefighter, right? Like, I mean, that's basically what Jeffrey's trying to tell us right here, right? Is basically call the right people for the job, right? Like, if that
hmm
happens, right?
I
but
feel
I
like
just wonder, does calling it actually like
Yeah, like what
because I
what
think
mm,
one of the coworkers had one too, and they called that number, and it was like it wasn't very helpful. They were just on hold and stuff like that. So it's like
mm.
I don't know.
so
So
to what
see
degree does it help, right? But
Yeah.
with what you said there, and then what you previously said about stress, like sometimes when people get discharged or like insurance issues, and then these people who can sometimes have unfortunately suicidal thoughts. That's stress. I feel like when you work in psychology or like any type of health profession, you get exposed to these things more often. Nurses, etc. What are your like stress management techniques? Or like I know you said specifically like you do things on the side, but like in those moments, sometimes you have to also like address it like mentally, right? Like
When I'm
it's
dealing with patients like kind of
yeah,
lashing out and stuff,
yeah, mm-hmm,
I, I feel like I have a pretty good hold of just I just kind of let them hash out a little bit and then kind
mm-hmm.
of get them back to what we're trying to do. And if they're really mad about that thing, we won't talk about it for now, or maybe say, give me a second, let's talk to. I'll have the manager contact you.
put it on the
So I'll
Mm-hmm.
shelf. Yeah.
push it off to the manager. No, but but yeah, no, I usually don't. I just let them. Yeah, I don't get too emotionally attached or anything. But of course, the first time when I had to deal with like a
Hmm.
more a patient that was who was pretty mad, uh,
Mm-hmm.
it was tougher. Like I felt it the rest of the day. I felt like yeah, it just took a toll on myself too.
Like it weighed on you,
Yeah.
right? Yeah.
Yep, yep. And that patient left a pretty bad review about me. It's on still on Google.
On
Oh
Yelp, it's on
no.
Yelp review. 0 stars, zero
It's
stars.
on Google.
It's on
It's
Google.
Google.
Oh
It's pretty
no.
funny.
Oh
She
no.
was like, yeah, because we were talking about discharge.
Mm-hmm.
And they weren't making their appointments and stuff and different things. I
Gotcha.
was a new grad. It was like my first couple months of work.
Newbie, poor newbie, Jeffrey. Permanently bad
Okay, young
review. Just
Jeru.
yeah.
Oh
Yeah.
no.
It's okay. It's okay. Pat him on the back, everybody.
He made it through, right? And he's still working. So good job, young Jeru.
Oh, and I want to add. So for the mental health, also, it can play a big role in pain.
Oh,
So with and that's what I want to talk about because I was thinking about it.
yeah,
But
yeah.
because with people with depression, people with anxiety, and stuff like that, that can negatively affect how you perceive your pain.
Of course,
And
right,
it can go in a vicious cycle too.
right.
Yeah.
Because pain is pretty complicated, and I kind of educate this with my patients a lot too.
Just a
So a lot
positive
of my
feedback
treatments,
loop messing you up.
a lot, yeah, I kind of talk to them about what pain and about how they can kind of manage it themselves, and how to kind of control the stressors in your life so that one part doesn't overflow, so that you can kind of help decrease some of that pain because it kind of comes from everything.
I mean, when you said that, it just made me think of like if we're all like a cup of water, right? And the water represents whatever pain or whatever, right? Just
Yeah,
like
that's the
you have to
yes
you have to be
the
able
water
to
cup
like
analogy.
yeah, you gotta be able to like
Yeah,
pour it out or not let it overflow basically, right?
exactly. Yep, I
Interesting.
like that analogy. Yes.
So now, after we talked about the mental health side, want to talk about some esports real quick. I know. back in the day, you watched some competitive esports, right? Some League of Legends, etc. Can you tell us a little bit about your, I guess, experience with competitive esports,
I
whether it be
watched
watching or like whatever you watch, basically?
it was well back in college when I played some league. I watched the like the worlds with the Taiwanese team TPA.
Oh yeah.
Hmm. What is it?
But
TPA was what was
was
it?
it TP?
Taipei Assassins. That's what they
Yeah,
were.
there you
Taipei
go.
Assassins.
Taipei
Taipei
Assassins.
Assassins.
There you
Yeah.
go. There you
They
go.
were like in like the earliest few seasons of League of Legends, and they were like they were actually really really good. I remember that. Yeah, I don't remember. Did they win? They might have won Worlds. I
I
can't
feel like they
remember.
did at one
I think they
point. And
won.
honest,
Maybe one.
like straight up, honestly, Taipei Assassins is like a pretty dope name.
That's
I'm
pretty
not gonna
cool.
lie. I thought it was cool.
Yeah, I remember that. I remember
um,
watching that with you.
when I watched that, I feel like a couple of our friends that were also maybe from like, ah, maybe I'm wrong, but like they would always like in league like maybe have the skin from that
Oh
year for
yeah.
Taipei. They'd be like, yo, check it out, Taipei represent or some shit like that. Oh man,
Little bit
good
of
times.
little bit of pride there, right? Like you can like represent a country or like a group of people or like this team specifically, and like shout out to them. It's like, oh, I was there in the beginning, right? Like, so that's pretty cool.
So
Yeah.
to go along with that, like nowadays, like I don't know if you've kept up too much, but like let's say like teams like Taipei Assassins or like today's modern era pro esport teams, right? So what type of resources do you think these teams should need to help their players succeed? Like, you know, in traditional sports, like let's say football, basketball, they could have the sports psychologists, I don't know, like trainers, etc., blah, blah. I don't know, like, is there maybe a role for like a PT, like an on site PT for some of these guys to kind of like get them, I don't know, like you said, better posture or like just like be aware of doing all these like little things.
Trainers even, right? Like
Yeah, trainers,
trainers or
nutritionists,
physical
etc.
trainers or physical therapists whenever they need them on payroll maybe.
I feel like there should be a need for that. We can probably play a role.
Hmm.
PT and OTs
Mm.
for sure. The OTs can definitely they can probably chime in a little bit more because for us where I work, we're kind of separated with like the upper body and lower body.
Hmm.
And
Okay.
PTs we work more on the lower body, and then the OTs will
Mm.
work more on the. Even though we've dealt with that too, but OTs they're more like the hand specialists.
Oh, really? Wow.
Mm.
Um,
Okay.
mhm. There's like hand therapist certifications and stuff.
Who's an OT that we know, Mike?
You know, y'all, we can't say his real name yet, but we got a guy named Young Saucy. He used to be our IGL in CS:GO. Be on the lookout. He's going to be a pretty interesting interview, also.
Yeah, we'll
Okay,
have him soon.
yeah. Shout out to the OTs.
Shout out to the OTs. Yeah, so like
But
I mean
yeah.
like cuz like you know the professional traditional sports teams, they've got probably team therapists, they got team trainers, they
They
got
have.
like right?
I don't think they have OTs on site, right? They usually like
Probably
physical
not.
therapists.
Yeah, but I'm
I
sure
feel
they
like
have
they
like
PTs.
yeah, they must have PTs because there's like all
They have
injuries all the
PTs.
times. Nutritionists, right? And another shout out to another
Shout out
episode coming
to
up.
Nick Hernandez, our previous interview's older brother, Connor Hernandez. Be on lookout for him. He used to be my trainer also, and he definitely studied some nutrition. So it'll be an interesting talk for him and the role that they play in a gamer or pro gamers, I guess, schedule or regimen.
How do we feed that mind? How do we feed that body, right? Like putting the input output right there, right?
Yeah, your body's a temple, right?
Yeah, so I suppose I don't know because like I guess would you think that esports might benefit from those kind of resources being available? I guess. What do you think?
I think so. Yeah.
All right, well let's sign Jeffrey
sure.
up then, man. Like let's have him on an official esports team.
On a team.
Remember, we're gonna start
TPA.
a university. Remember, we're gonna have Gally as a professor, and then we can just like sign Jay-Woo to be the PT for that. You know what I'm saying?
There you go.
I'm down. I'm down.
But all right, so now we're gonna bring it back to some real physical therapy having to do with the esports. Now that we've talking or spoken about it, on a previous episode we had Gally Cribs tell us about he had like an abdominal strain, and I mean this might not be in your area, but like that's kind of close to like your back slash your spinal cord, right? How would he go about that? Like
What's the recovery?
trying to recover for his recovery or his
Like
rehab.
Yeah.
You said abdominal strain.
Yeah, abdominal
Yeah.
strain.
So so how I would look at it is like the level of pain right now and kind of what happened, what how did he injure it, how did he strain it.
Mm.
But in terms of muscle, usually it should be getting better like after 2 weeks or so.
Oh, that's quick. Yeah.
But it depends on, I guess, the level of the strain. You know, grade 3, grade 2, grade 1. But also, and then with rest, you want to rest, but you also want to find how you can balance and moving and still trying to do things without kind of poking too much into the pain.
So like
So a lot
slowly,
of it,
gradually pushing the limit of like pain threshold or like
and figuring out
tolerance.
what you can do, and yeah, what things make it worse, what things make it better.
Gotcha. Okay.
And a big like one of the big things is we say it's like a graded exposure. You want to slowly build back your tolerance to what you were doing before and the capacity of what your body can handle.
Graded
So that's a
exposure. Taking notes.
that
Taking
can
notes.
that works with a lot of injuries, almost all injuries. That's kind of the approach. But yeah, it really depends, and it's hard to say because
You'd
like
have to know the
a lot
more
of people
specifics,
ask
right?
me,
Okay.
yeah, more specifically in terms of the history and kind of yeah and everything,
Cool.
and doing some like manual quick tests and kind of see how it goes.
So you got to put your hands on it and find out, right? Like you got to be like, what's
A
going on
little
here?
bit. We don't always have to put our hands on it.
Sure. So the mechanics.
But does it help? Like in general, like
Like
would
manual
it help?
therapy.
Mm-hmm.
Yeah, manual therapy can help, but it's always manual therapy is always like an adjunct to exercising to
Mm.
doing things. So if you're just doing purely manual therapy, it's not the most effective way. Yeah, I always like to
Interesting.
couple some manual therapy with other exercises
Okay. Good to know. Good
because
to
it's more
know.
passive. Manual therapy and like and different things like ice pack, hot packs, those are all passive treatments.
I'd like to
True.
request a massage from Jeffrey, please. I'm feeling a little bit strained in my shoulders. You get a little massage right there, right? Mike, are you tilted?
I'm just a little tilted today, but I think Jay Woo, are you tilted?
I'm tilted, fully tilted.